Greetings. This is the second attempt at doing this podcast because the last time the microphone didn't work. So we're trying this new gadget thing. Great. Today I had a blood transfusion. I'm not sure quite what my HB levels were, but they were obviously in my boots. So I'm supposed to be feeling ding, up and about and really reassured, but to be perfectly honest, I'm feeling a bit queasy. My temperature's up a little bit, 37.2, so I've got a thermometer here because I'm restarting my chemo tablets tomorrow evening. Tomorrow evening as opposed to this evening because it's been a very long day at the hospital and I'm not feeling 100% and I do need to have a good night's sleep, so we're going to be starting them tomorrow. The name of the chemotherapy tablet is Navabine. Navelbine. Now these little buggers are supposed to be really, really strong. So strong that I'm not supposed to try and touch them with my hands. So I've got to try and take them out of the packet, put them in a little bowl and tip the bowl up into a mouthful of water because they're not supposed to touch the sides of my mouth either, because they could irritate that. So they could irritate my hands by touch, they can irritate the side of my mouth by touch, so I've got to take a river full of water with the tablet so that it doesn't touch the sides of my stomach my food tube, you tell me what that is, going down. On top of that, half an hour before taking the tablets, I take omeprazole, which, as you all know, is an anti-sickness tablet. I just realised I really look so booby in all this. Anyway, yes, so I take omeprazole half an hour beforehand, and if I need to, I can take omeprazole again 12 hours after taking the chemo tablet. The side effects of this particular treatment are a couple of days of nausea and potential vomiting. Mother Nature can mess around a bit, but then Mother Nature messes around anyway. It doesn't really take much excuse for her to mess around. And thinning of my hair. Now, having had breast cancer 3 years, 2011, and losing my hair back then, thinning may not seem quite so bad. It depends on how thinning it gets. If it goes like alopecia, which is sort of patchy things, where your hair's thick here and nothing here, and then patchy here and thick here, I think I'm going to take the whole lot down. Back down to how it was when I lost my hair before. This means that obviously I will be bald from now to Vienna. So is that really fair on my boys to see me? I will look poorly as well as be poorly. Although my attitude doesn't exactly give anybody the impression of me being poorly. I am a very poorly young lady. But having the scarf or a wig, I'm in a bit of a quandary on that one. If, however, my hair comes out just thinning and I can do all sorts of weird things with hairstyles and things to thicken it, then that'll be fine. But these are all sorts of things that go on in a patient's head. Do I, should I, could I, would I, may I, possibly do I do this? So a patient has got all sorts of questions going on in their minds, and they're always thinking, the majority of patients are always thinking of their family before themselves. How much of an effect will this have on my boys? How much of an effect will this have on my husband? What you have to do is try and bring that patient down, bring that patient back to thinking about themselves sometimes, and telling them that they have permission to be frustrated, they have permission to feel angry, they have permission to think about themselves once in a while, instead of their family and their friends. That out of your 6 C's can take compassion and courage. My youngest son, Jacob, will possibly be doing a podcast of his own. My 2 boys are very different. You've already seen the podcast of Samuel and my husband. Both of those 2, both my husband and Samuel, are very much alike. Jacob is far more like myself. Jacob has a great compassion for others. Jacob, and he won't mind me saying this, is partially Aspergic. So he has like a filter. It's very mild. He has a filter system where he can do things his way, and his way is very different to most people's ways of handling things, which is fine because I love him and respect him a great deal. Without him, trust me, I would not be doing this right now. He has been my rock. He has been the one who has held me at times when I've needed holding. He has a great heart for me and a great love for me, and that has become a lot closer over recent years and months, really, particularly over recent weeks. When Jacob speaks, he will speak from his heart. When Samuel spoke, he spoke from his mind. That's not belittling Samuel, because Samuel is very much a mind person. Anything to do with his heart, I think he's too afraid. He and I have reached a bit of an impasse at the moment. He and I clash. This is what you've got to know a little bit about your patient, is that you need to know a little bit about the chemistry between the patient and their family, particularly if you're working in an area like oncology or high dependency care, or areas where it's quite intense emotions that the disease or the disorder can provoke. You've got to know a little bit. For example, if a patient's friend comes in and the first thing you ask is, are you next of kin or are you family? That person will say no, but I've known this patient for 50 years. What do you do? For me, I would say go in. By all means, go and see them. Because you have to ask yourself the question sometimes, is blood necessarily thicker than water? For example, with myself and Samuel, I believe when Samuel looks at me, he sees one great big tumour. Because he literally shouted at me the other day, I am sick to the teeth of talking about cancer. I'm fed up of it being the subject all the time. I'm fed up of it being around all the time. And he shouted at me. And sometimes the way he speaks to me is extremely challenging, shall I put it that way. So sometimes when you talk to your patients, you have to be sensitive as to what the relationships are going on at the time. These are probably more when it comes to palliative care and people in my position. When you are in a position of being able to create a rapport with your patient, when a patient is with you for a length of time, then you create, I'm going to say the word relationship, but it's in context with professional relationship with the patient. Like I said, Andrew and Samuel, their podcasts were said very much from their mind and their brain. My podcasts and Jacob's potential podcast, I'm not saying he's going to do one because I don't want to push him, but his podcast will come from his heart. My mum and dad will probably not manage to do a podcast, because I'm their daughter and their only child as well, so it's probably going to be too sensitive for them. I have two very close friends who I know are going to be very happy to do a podcast. I have an aunt who may well do a podcast in sort of to represent my parents. Like I said, I had a blood transfusion today. That was 2 bags of other people's blood that are now running around inside me. Within 6 months, it'll be my own blood that will take over. It feels a bit strange. This is the second blood transfusion I've had in my life. But it does feel strange watching the red stuff dripping through the system and then seeing it going into my arm. For those of you out there who do not give blood, but are capable of doing so, please give blood, especially you youngsters, and Asian, African, you are desperately needed out there. But they are needing blood as much as possible. I'll contact you again in about a week, record again in about a week, should I say, so you'll have a better idea as to what the actual effects of the chemotherapy have done to me. So until then, like I said, get to know a little bit about your patient, get to know a little bit about the relationships within your patient's life, whether some friends are closer than family. You have the privilege of being in your position, student nurses right now, and you'll have the privilege of nursing patients later. Never ever forget that the position you're in is a privileged position. I'll get more to that another time. But for now, God bless.